The importance of screening is, of course, for early detection. Why do we send children to preschool and why do we send them to kindergarten? Because we know that early intervention works. And we know for lung cancer screening, if we can catch it early, the chances are survival, we have a better chance of treating it.
It's time to meet another LCFA patient advocate. You may recognize her name, Annabelle Gurwitch. She's a New York Times bestselling author. She was also diagnosed with stage 4 lung cancer in 2020. Thanks to the latest advances in biomarker targeted therapies, Annabelle hasn't had to miss a beat and gets to dance the night away, as you'll see here in just a moment at the Lincoln Center Silent Disco. The disco might be silent, but her energy living with lung cancer is louder than the music any speaker could possibly play.
The composition of each person's lung cancer is unique, and that is why it is so important that you need to know your biomarker because it can allow for targeted treatment.
ROS1 positive is a biomarker which can drive the growth of a cancer tumor. But thanks to research, we now have precision medicine that combats that growth.
ROS1 is the topic of the LCFA Hope with Answers podcast. So take a listen.
Dr. Patil, can you tell us a little bit more? What is ROS1? How do you define it?
It's a great question. So ROS1 non-small cell lung cancer is a mouthful. So let me break it apart. We have the last part, which is non-small cell lung cancer. It's a type of lung cancer. And the ROS1 comes from this growing trend in lung cancer where we're going beyond just calling it lung cancer and really getting down to the genetic level. And so ROS1 is a type of mutation that we see in patients who have lung cancer. It's one of many, but it's an important one because there's targeted treatments available to these patients that really are not like chemotherapy. They don't have the same side effects. They're very different. And so that's where the term ROS1 non-small cell lung cancer comes from, is it's really recognizing the importance of one, doing genetic testing, and two, trying to pair patients with targeted treatments if that's appropriate.
You really go through a lot, I think, and the roller coasters of this disease. So that's not always visible, obviously, on the outside, except for those that are really close to you. And I just kind of take that as an opportunity to explain to them that we're really lucky to have some great treatments right now that allow me to live as close to normal life, as I used to before cancer.
Lisa, the other thing that I think is interesting is that you know your ROS1. How important was it for you to find out that you were? And what kind of a difference does it make once you know what that biomarker is?
For me, it was a game changer. Absolutely. You have to remember when I was diagnosed, it was 12 years ago, and biomarker testing wasn't common practice at the time. So I actually didn't know about that driver until 18 months after being diagnosed. A lot of people think of, you hear the term a lot, you're being a guinea pig. This is that they're just testing that on you. Every single drug that's been approved that we take has been tested. And that's the only way to find out if it's safe, if it works. And I feel like it's my opportunity to give back and help and contribute to research to further treatments for this disease. But also it's a great opportunity for me to be getting the newest and most current up-to-date treatment that's out there.